Hey you guys, it's Stephanie here. Welcome to my channel. I am hopping on today to talk about a little bit of news, actually, which is something I haven't done before. But I wanted to discuss how the World Health Organization just redefined what burnout is and actually assigned it a code in the ICD-11. This is huge for so many reasons. But first, if you're new to my channel, make sure you subscribe. Hit the bell so you don't miss a future video. I'm going to be doing this more often, I think, because there's a lot of news to talk about. Oh my gosh. Let's get into it. Yesterday, it hit the headlines that the World Health Organization, or WHO, came out and redefined burnout for employees. This is a huge deal for us nurses because, as it's been extensively documented, we suffer from very, very high rates of burnout. Caregiver fatigue is real. Not going to get into all of that. This is huge because they went from defining it as just a vital fatigue that's kind of general related to employment or unemployment to really going into greater detail. I'm going to read it for you. Now the World Health Organization defines burnout as this: a syndrome conceptualized as resulting from chronic workplace stress that has not been successfully managed. It's characterized by three dimensions. 1, feelings of energy depletion or exhaustion. 2, increased mental distance from one's job or feelings of negativism or cynicism related to one's job. And 3, reduced professional efficacy. Burnout refers specifically to phenomena in occupational context and should not be applied to describe experiences in other areas of life. Haha. So what we're really talking about too is end stage capitalism. I have experienced burnout as a nurse. I am still working at the bedside. I've been working med-surg and in the emergency department for 3.5 years, and I have definitely been on the edge, teetering on the edge of burnout several times in my nursing career. So I'm happy to see this subject hit the headlines. But now what? 3 things really concern me, and I want to open the discussion up with you guys in the comments below. 1, what does this mean as far as an actual diagnosis? The ICD-10, it does not really determine what is considered a diagnosis. They use this coding system to bill for your office visits. Every kind of syndrome or symptom or complaint is designated a code. If you get an itemized bill from your clinic or hospital, you will see these codes. Now, burnout is one of them. Number 1, how is insurance going to cover this? That is a big concern. If you get billed for burnout or symptoms of burnout or discussing burnout in your office visits, how is insurance prepared to cover those? Number 2, what does this mean for treatment? How is treatment going to be determined by your providers? So if you have complaints of burnout, what are they going to tell you to do? Are they going to give you lifestyle recommendations? Are they going to give you nutritional advice? Are they going to make referrals to you for health coaches or registered dietitians or physical therapy or R&R? Is it going to be like a worried well visit? How is this going to affect workman's comp? I have a lot of questions about it. And number 3, on the other end, how are we going to actually start preventing this? Is preventive medicine going to catch up in a really kind of mainstream way in the way that we are handled in the system? Because as we know, prevention isn't really showing up for us in that way. If we are going through conventional medical treatment, those methodologies are not discussed with our providers. So 3 huge questions about burnout having an ICD-10 code now. Now what? Just to recap, how is this going to affect billing? Number 2, how is this going to affect treatment? And number 3, how is this going to affect prevention? What are all of these 3 things going to look like for patients and for nurses and doctors who seek treatment for burnout? what's it going to look like for us? Discuss in the comments below. Again, make sure you subscribe to my channel because every time a headline hits like this, I want to talk about it. I don't know the answers. I just know what questions to ask. All right. See you soon.